Meanwhile, COVID numbers are rising rapidly across the country, and that means private hospitals too are also witnessing a rise in the number of patients. What does it feel like to be in a COVID ward of a private hospital? India Today tells you.
India Today went inside Max Smart Super Speciality Hospital to see how patients were spending their days. Some of whom were oozing positivity.
आने से उनके आए बाहर, जाने से उनके जाए बाहर, बड़ी मस्तानी है मेरी महबूबा.
Over the past few days, pictures of doctors and healthcare workers in PPE kits broke the internet. India Today found that it wasn't easy to get into one of these suits as it looked.
Making sure no part is exposed because we will be going inside the COVID ward where patients are being treated at the moment. So let's get on with it.
Once inside the suit, we made our way to the COVID ward. Max Hospital has dedicated the entire building for COVID patients. All 200 beds were occupied, and every bed felt like an island in itself where patients were maintaining social distancing among themselves. The ones getting discharged were happy, all smiles.
इनका मैं एप्रिसिएशन करूंगा, तारीफ करूंगा कि मतलब बहुत ही अच्छा जो है पेशेंट के साथ इतना अच्छा कोऑपरेशन है और ट्रीटमेंट भी बहुत अच्छा है. दिन में मोबाइल में थोड़ा सा एंटरटेनमेंट का कुछ जो है धार्मिक चीजों को देखता था, भगवत गीता का जो है थोड़ा, तो इस तरीके से जो है कुछ पेशेंट भी आपस में जो हमें आपस में बातचीत कर लेते थे. एक मैडम थी यहाँ पर जो है काफी एजेड थी, 80 ईयर्स की, तो वो भी अभी डिस्चार्ज होके कल गई हैं.
Most of the time I was, either I was singing songs or something. I was entertaining myself. I never thinking about I'm positive. I have a lot of appreciation words for all the staff, all the doctors and nurses and GDA also, and even the cleaners.
The building where I'm standing, the entire building has been dedicated for COVID patients. There are approximately 27 beds in this facility. It used to be an emergency ward, but now solely dedicated for COVID patients. You can see as we start, there are 3 patients. People are making sure that there is as much isolation as possible. Everyone here is wearing a PPE kit, from the doctor to the people who make sure that you get your admissions to the ones who are serving you food. These are the people here who are now making sure that the patients get their medication on time. Everyone is fully geared because the idea is to make sure not a single part of your body is exposed. You can see just 2 patients in this entire area. They have to make sure that nothing is contaminated. They also have to make sure that there is enough social distancing. In fact, in this room, you can see that there's just 1 patient in the entire room because the contamination levels are that much higher.
The entire ward was full of COVID patients who were keeping themselves busy and, despite testing positive, exuding positivity. They also appealed to others to be cautious but to not lose their minds over the disease.
Nobody should be scared that I'm going to admit in the hospital or I am positive, I need to hide the things. My wife, she clean up my room, so she have a PP kit. You are also wearing, how difficult to wear it. I was all the time connected with my office staff, I have my own office. I'm the director of the company.
We moved on to the ICU ward on the first floor of the building to see the facilities there. Constant monitoring of patients, the one thing that is different in a COVID ward from other wards in the hospital is that names of healthcare workers are written on their PPE kits. And that makes it easy for patients to recognize their doctors and nurses.
On this floor, there are roughly 50 beds. As you can see, everyone is covered from head to toe because the idea is to minimize exposure. Even I am wearing a PPE kit which covers my hair and it covers the nail of my toe. Everyone here is a COVID patient. The doctors are making sure that there is isolation which takes place between one bed and the other. Patients are in an isolated state and social distancing has been maintained.
Doctors in the ward work in shifts, but shifts now mean long hours due to the pandemic. Most doctors work for 8 to 10 hours. Despite high exposure, they remain calm and composed.
They do have the fear because people think that if I have got COVID, I don't know what is going to happen, how will I live, how will my lifestyle, how I'm going to respond. That fear is there in patient's mind, but they are responding well. If you left alone out of your family or from a relative, definitely you'll have there is no one to care for us. But we know we have a nursing team, we have a doctor team. We come and talk to them. They have to be little strong. They have to meditate on the time, if they are inside this hospital premises.
But not everyone was leaving the hospital with a smile. Some left lifeless.
The hospital where I am standing right now declared dead someone just a few minutes ago, and now the mortal remains of the person are being taken into the ambulance. The foremost thing which people at the hospital now do is to make sure that every part, every surface is covered because chances of contamination are very high. The Supreme Court, the central government as well as the state government has asked private hospitals to fight with the government in this war against COVID. The hospital where I'm standing has given out 1/3 of the total beds across the country, and the authorities are saying if need be, they'll make sure that they give out more beds. This is Aishwarya Paliwal reporting for India Today with camera person Rohit Sharma.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.